Pneumonia is an infectious disease which mainly affects the air sacs of lungs and has a characteristic inflammatory nature of progression. It is usually caused due to bacteria or virus, but drug-induced pneumonia is not common either. Occasionally, pneumonia may occur as a complication of flu. It is one of the most common causes of mortality related to hospital-borne infections. Pneumonia symptoms may range from mild to severe and include cough, fever, chills, sputum production, breathing difficulty, and chest pain. This disease may spread to healthy individuals via coughing, sneezing, and in some cases even through touch, like coronavirus. It can also spread from individuals who are infected but do not show any symptoms of the disease. But this disease can be cured for sure. Hello and welcome to another video of Ingenious Ayurveda. In today's video, we are going to discuss the causes and Ayurvedic treatment for pneumonia. So if you want to know more about this disease and the Ayurvedic treatment to cure this disease, then stay with us in this video till the end so you don't miss out on important information. In Ayurveda, pneumonia is called respiratory fever. Major symptoms of respiratory fever including feeling stiff with increasing body temperature, chest pain, cough, and mucus. There is also difficulty in breathing and exhaling and problems of breathlessness. The nadi, which is also known as pulse, becomes soft, heavy, and sharp. Other symptoms of this include sweating on the forehead, fatigue, weakness, mania, and dry and strange feeling on the tongue. It is advisable to be admitted to the hospital immediately if the pulse is too fast and there is difficulty in breathing. So basically there are 5 types of pneumonia that you get to see. These pneumonias are bacterial pneumonia, viral pneumonia, mycoplasma pneumonia, aspiration pneumonia, and fungal pneumonia. Now what are these pneumonia? So if you look at bacterial pneumonia, this type of pneumonia is caused by several bacteria. The most common being is streptococcus. This usually occurs when the body becomes weak in some way, such as illness, nutritional deficiency, old age, or body immune problems that cause bacteria to pass into the lungs. Viral pneumonia is the kind of pneumonia is caused by several viruses including influenza. If you have viral pneumonia, then you are more likely to get bacterial infection. Mycoplasma pneumonia has somewhat different symptoms and is called atypical pneumonia. It is caused by bacterium called Mycoplasma pneumonia. It usually causes mild but widespread pneumonia which affects all age groups. Aspiration pneumonia is caused by any food, liquid, gas, or dust. It is also known as necrotizing pneumonia, anaerobic pneumonia, aspiration pneumonia, and aspiration of vomiters. This type of pneumonia is sometimes difficult to cure because people who have aspiration pneumonia are already ill. Last but not the least is fungal pneumonia. This type of pneumonia is caused by various endemic or opportunistic fungus. This causes fungal infections such as histoplasmosis or blastomycosis. Cases of fungal pneumonia are quite difficult to diagnose. Now, what are the common symptoms that one gets to see when somebody is caught by pneumonia? So, if you have pneumonia, you will have flu-like or chest infection. In a few days, the symptoms may develop slowly or progress very rapidly. The main symptom of pneumonia is cough. You will feel tired and weak, and you may have any other of these symptoms, which are mucus cough, fever, difficulty breathing or rapid breathing, chest pain or discomfort, loss of appetite. There are some grievous symptoms as well, such as rapid breathing, confusion, low blood pressures, coughing up blood, bursting speed, or nausea and vomiting. Now let's get straight to the Ayurvedic treatment for pneumonia, and the herbs can be taken to cure it. The very first Ayurvedic herb for pneumonia is amlaki. This herb is well known for its immunity enhancing and anti-aging properties. Amla fruit is particularly indicated in the treatment of anemia, asthma, diabetes, cold, and chronic lung disease. Additionally, it is used for treating hyperlipidemia, yeast infection, and cancer. Amla is effective in relieving symptoms of lung inflammation associated with pneumonia. Amla hosts several antibacterial compounds which aid in clearing out the infectious microbes responsible for pneumonia infection. Flavonoids and vitamin C in amlaki are potent antioxidants that prevent lung tissue damage associated with pneumonia. So, amlaki can be used to cure pneumonia, which is available in the market in various forms. The next herb is kutja, astringent and antibacterial properties. It has been used in Ayurveda for treatment of a number of diseases such as diarrhea and pneumonia. Kutja is an excellent antibacterial herb which makes it effective in the treatment of pneumonia. The next herb is Bhringraj. This herb grows extensively throughout India. Leaves and roots of Bhringraj have been used in Ayurvedic medicine for its antipyretic, rejuvenating and tonic. It also exhibits antibacterial, immunomodulatory, antioxidant and anti-hepatotoxic action. Together, these properties of Bhringraj are useful in reducing the microbial activity associated with pneumonia and improving the overall health. Bhringraj is administered in the form of infusion, powder, decoction, medicated oil or ghee, or also known as classified butter. The next herb is til. Seeds, oil and leaves of til are used in Ayurvedic medicine for various therapeutic purposes. It acts as a tonic and rejuvenator and aids in the treatment of diseases associated with the reproductive, excretory, urinary and respiratory symptoms. Til helps treat pneumonia by inhibiting the action of microorganisms associated with this infection. So this can also be used to cure pneumonia. Guduchi is the next herb on our list. Guduchi is one of the most widely used antipyretic and immunomodulatory herb in traditional and Ayurvedic medicines. It also possesses anti-inflammatory and antioxidant activities which are helpful in treatment of pneumonia. Guduchi is administered as a swarasa or juice at a dose of 10 ml daily along with honey or pipli churn in order to reduce jara associated with pneumonia. Now let's look at some of the Ayurvedic medicines for pneumonia which are available in the market in medicine form. Goro Chanadivati. This formulation is prepared from fresh adrak or ginger, kalmeg or green charaita, horns of goat and deer, processed gold and galena. It is mainly recommended for the treatment of chronic fever, intermittent fever and respiratory disorders. Goro Chanadi Vati is generally administered with honey twice daily. It is recommended to consume this preparation 1 hour before meals. Next medicine is Sanjeevani Vati. This is one of the most commonly used herbal formulation. It consists of Vedanga or false black pepper, shunti or dried ginger, pipli, haritiki or chabulic, myrobalan, bibhitiki, amlaki, guduchi, and shuddha bhalataka. Sanjeevani Vati has appetizing, digestive and vata regulating, fever destroying and poison removing properties. It is typically administered with honey for the treatment of pneumonia. Last medicine of the day but not the least is Sudarshan Churna. Powdered form of this medication is specifically indicated for the treatment of fever. It is an Ayurvedic formulation made of 48 herbs with chiraita as the primary herb. Sudarshan Churna is best taken with cold water and is highly beneficial in the treatment of pneumonia. If you follow this regime, you will surely get over your problem of pneumonia soon. But as we advised earlier, do visit a Ayurvedic doctor to get a treatment right. Hope you like the information. If you like the video, don't forget to press the like and share button. And if you haven't subscribed to the channel, subscribe it now and also hit the bell icon. Till then, take care and have a healthy life.